This video shows how to use an Ellipta. First, check the dose counter. The dose counter shows you how many doses remain. If the counter reads 0, you will need to replace the Ellipta. Slide the cover down until a click is heard. You don't need to shake the Ellipta first. Breathe out gently, away from the Ellipta. Put the mouthpiece in your mouth and close your lips to form a good seal. Be careful not to block the air vent with your fingers. Breathe in steadily and deeply. Hold the breath in for 5 to 10 seconds, or as long as is comfortable. While holding your breath, remove the Ellipta from your mouth. Then breathe out gently away from the Ellipta. Make sure you don't breathe out into the inhaler. When you're finished, slide the cover upwards as far as it will go to cover the mouthpiece. After taking your dose, rinse your mouth out with water and spit it out.